Cinnamon is a spice used for thousands of years in many cuisines around the world. In fact, many of us have a lifelong love for cinnamon cookies or biscuits, cinnamon rolls, cinnamon bread. However, did you know that cinnamon is also useful for many health conditions? Now, in this video, I'm going to talk about a very well researched part of cinnamon, that is use of cinnamon in diabetes. And I'm going to tell you 4 different ways cinnamon actually helps in diabetes. It's not just a fringe benefit, it's a very serious and big benefit for it. However, there are also 2 or 3 important points besides that. The cinnamon you get from food is not enough to give you that benefit, so you need to take more cinnamon. That's one bad part. Second, the type of cinnamon most people eat, it's actually not going to be good enough. Even if you take in large quantity, it can cause some life-threatening conditions. So that's also what I'll be covering in this video. And finally, I'll tell you what you should consume, how much you should consume, and what kind of results you can expect. So I'm going to cover 4 different ways cinnamon is going to help you in diabetes. Let's begin. The first way cinnamon helps is by reducing carbohydrate digestion. Now, there are certain enzymes in your intestine which help you digest complex carbohydrates such as starch or polysaccharides into glucose. Now, cinnamon reduces the actions of these enzymes, and so the glucose production is much less. It's as good as you having not eaten those carbohydrate foods, or at least eaten less of those. And so by indirectly controlling the blood glucose levels, cinnamon helps in preventing diabetes as well as controlling diabetes. The second way cinnamon helps is by slowing down stomach emptying. Now, it's a very complex process, very complex, lots of feedback loops and various hormones being involved. Let's just keep in mind that slowing down stomach emptying helps you have less postprandial or post-meal blood glucose. Okay, and also the slower the stomach emptying, the feeling of satiety is more, and so you don't feel hungry more frequently or earlier, you can say. And cinnamon, by lowering this, helps you feel full for a longer time, as well as have control over your post lunch or post dinner blood glucose levels. Now, this feature is beneficial for preventing diabetes, because if your post meal blood glucose doesn't go high, that's good. That will keep your chances of developing diabetes less. Now, it should also help if you have diabetes, but it actually is sort of a equal yes no wise. Why? Because 30 to 50% of diabetic patients have something called gastroparesis, and that is reduced stomach emptying rate. So they already have that problem, and it's not just reduced, it's erratic stomach emptying rate. So I would say it's sort of neutral. If you are diabetic, then cinnamon's reduction of stomach emptying rate is probably not going to be helpful to you as much. And also, you should not have very high dose of cinnamon as a result if you are diabetic and diabetic for a long period of time. That is, you have it for a few years, then you develop gastroparesis. At least 30 to 50% of the people develop. The third way cinnamon helps is by lowering insulin resistance. It reduces insulin resistance in fat cells and muscle cells. Now, this is also important because insulin resistance is supposed to be one of the main causes of development of diabetes. Basically, what happens is your body's cells become resistant to insulin. The insulin doesn't work as well, and so they don't get enough blood glucose, and the blood glucose goes up and your cells don't get it. So blood has higher levels of blood glucose, but your cells don't have it. As a result, you get that entire diabetic condition, complex situation. Now, if you reduce the insulin resistance, the little insulin that your body has, if you're diabetic, can go a long way in helping blood glucose into the cells, and so that's great. And so by having reduced insulin resistance, cinnamon helps in preventing diabetes, and it also helps control diabetes much better. The fourth way cinnamon helps is by mimicking insulin action. Now remember, if you're diabetic, your body has very little insulin secreted, and so therefore the insulin action is restricted, and so blood glucose doesn't go into your cells to be used. And cinnamon has many compounds which act like insulin in some body processes, not all, and so they allow your body to utilize blood glucose better as if the body has insulin. And so indirectly, by mimicking insulin action, cinnamon reduces blood glucose levels. Now this may not be so useful if you don't have diabetes, that is to prevent it, because you already have enough insulin. However, if you already have diabetes, this is a great feature to have. Now the big question, see, cinnamon helps in this way and that way, these are all nice to know, but does it actually lower the blood glucose? Because if it doesn't lower your blood glucose in real human beings, then all these things is just theory, it's of no use. And so some trials have found that cinnamon reduces blood glucose in diabetics by 10 to 30%. So that's a great improvement. That's a great benefit. Okay. And so cinnamon, you can safely say, is useful for diabetes. But remember one thing, cinnamon is not a medicine for diabetes. So please don't stop your current diabetic medication. Just this is like an additional good food level natural intervention. Now, I have seen people sometimes saying, oh, something natural means great, so abandon the conventional medicine and I'll take natural. Please don't do that. It's not safe. And so make sure you continue with your medication, understand what I'm explaining, and have a word with your doctor or whoever is your caregiver for your diabetes. And if both of you agree, then you can add extra cinnamon in your food, because eating a little bit of it is good, but it's not going to give you great benefit, as I mentioned, because the amount of cinnamon that have been used in the trials which have shown this benefit have been more than typically what we eat in our food. Finally, cinnamon has great anti-inflammatory and antioxidant properties. So all those usual suspects which are affected by free radicals or inflammation, they benefit if you take cinnamon. So cinnamon has been found, and this is research in last 20 years. Okay, this is not some ancient science. Though ancient science is also great, it's just that a lot of people want modern evidence. They want modern ways of testing, modern clinical trials, modern publications. So I'm taking data from last 20 years to tell you that cinnamon has been found to be useful for heart disease, prevention of cancer, for reduction of inflammation, controlling certain infections. It has been also found to be beneficial for Alzheimer's disease and Parkinson's disease. So these are extra benefits along with control over your diabetes. So all this sounds very exciting, right? Using the stuff that we use on a daily basis, cinnamon, just is going to help us with diabetes, preventing or controlling it. So great. But wait, there are a few more things you need to know. As I told you, just jumping headlong into this can be serious. Number one, how much cinnamon do you need on a daily basis to get this benefit? It turns out that all the clinical trials which showed this benefit of cinnamon use between 1 to 7 grams of cinnamon a day. Now, how much is 1 to 7 grams? Because we don't think in terms of 7 grams, right? We think in terms of teaspoon or tablespoon. So a teaspoon of cinnamon usually has about 3 grams. And so experts advise you to have between 2 grams to 4 grams a day of cinnamon to get all the benefits for diabetes. So you're looking at having 1 teaspoon of cinnamon. Now the problem is cinnamon is not cinnamon all over the world. There are many varieties of cinnamon, and two main ones which are available in the market are something called cassia cinnamon and Ceylon cinnamon. Now cassia is everywhere in the world. Most of the developed country you see this, and that's the one we use typically, mainly because it's cheap. The earlier version, the good old days, used to have Ceylon cinnamon. In fact, many of the recipes that use cinnamon from 100 years back, Mexican recipes or many other recipes in the world, use Ceylon cinnamon. Cassia cinnamon is a little stronger. It's bitter and stronger, and some people find it good, so it has become popular, partly because it's cheap. Now, cassia has a problem. Cassia has a compound called coumarin. Coumarin is, I mean, you might have heard it in school chemistry, But coumarin in biological way in your body is very dangerous. Even a small amount of it, something bordering our daily consumption level, can cause liver damage. It also is known to cause some kind of cancers. And so coumarin in high amount is not good. In fact, in European Union, they have a cutoff for it. They say you should not have more than 0.1 milligram of coumarin per body weight, per kilo of your body weight. Now, let's say I'm 80 kilos. So that means I should not have more than 8 milligrams a day, otherwise, it can become toxic. Now, it has been found in testing that typical cassia cinnamon has between 2 to 7 milligrams of coumarin per gram. So let's take 7 milligrams of coumarin per gram of cassia cinnamon. So if you are going to have 2 to 4 grams for diabetic benefit, you are going to have 28 milligrams of coumarin a day because you take cassia cinnamon, 4 grams of cassia cinnamon. 28 milligrams. What did we calculate? For my weight of 80 kilos, 8 milligrams is safe. Beyond that is dangerous. And you are going to have 28 milligrams. I mean, it's going to cause cancer, right? Or you will get a serious liver damage. And so, if you are lesser in weight, it's even worse. And so, for all practical purposes, you cannot get enough cinnamon to benefit you in diabetes because it needs more cinnamon than you can safely take, and that you cannot take through cassia. And so you have no option but to go for Ceylon cinnamon. Ceylon cinnamon has been found to have negligible amount of coumarin. So you can have 2 grams or 4 grams, you're going to get almost no coumarin. There's almost no coumarin in it. And so Ceylon cinnamon is the only option. Now Ceylon cinnamon is very rare in these days in the market because cassia is cheaper and everyone wants the cheaper one. People don't differentiate that much between the cinnamon. Now another problem is if I give you cinnamon powder, there is no way you can tell because both look the same. You know, the colors, there's no way for your eyes to make out. The only way you can tell between Ceylon cinnamon and cassia cinnamon is when they are as sticks. Cassia cinnamon has very rigid, sort of a very strong looking single stick, cinnamon stick. And cassia's counterpart, that is Ceylon cinnamon, has very fragile looking, flaky kind of sticks. They have small layers. It's not like a thick bark. And that's the only way to know. And so if you are going to get it from market, have 2 to 4 grams of Ceylon cinnamon, have 1 teaspoon of it a day. You can put it in latte or in your food or whatever, whatever way you want. The other option obviously is to have Ceylon cinnamon supplement. If you take Ceylon cinnamon through a supplement, make sure that the tablet has Ceylon cinnamon standardized to something called 10% polyphenols. See, polyphenols are the active compounds in cinnamon, and various Ceylon cinnamons themselves may have slightly different amounts, 8%, 12%, 9% of the powder could have polyphenols. And so to standardize, the norm is to have 10% polyphenols. And if you take that much extract with 10% polyphenols, you know how much of polyphenols you are going to get. And that's called a standardization. But let's not go more into it. Just check on the bottle label because there's no other way you can figure out by looking at the tablets whether it has 10% or 5% in polyphenols. Now, couple of cautions. Don't take these cinnamon pills or cinnamon powders if you are a pregnant woman or you are breastfeeding. Some people are also allergic to cinnamon, and if you are, you already know that. In that case also you may want to avoid taking cinnamon or cinnamon supplements in this form. And as I said before, please don't stop your diabetes medicine. This is to be added to help you have a better control, and therefore you are better off discussing this with your doctor before you jump into adding this to your diet plus diabetes regimen. Okay. Now besides this, there are many other herbs that have been researched and found to be very useful in diabetes control. Herbs such as gymnema or ginger or Garcinia cambogia. I'll have separate videos on them. Here are some more videos that could be of interest to you. Thank you very much.